After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com. Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series Video on Demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom Roselle here. Welcome to Ageless Health live stream, and we had another great program for you. Hopefully you were listening to me on WMAL 105.9 FM, and we're going to get into basically why your hormones make you feel like you're not who you're supposed to be, right? Dr. Jekyll, Mrs. Hyde, Mr. and Mrs. Hyde. You know, guys, hey, listen, you're not impervious to this. Unfortunately, we go through something called andropause. So we're going to talk about the two kind of simultaneously, but I promise you, if you pay attention, you're going to understand this is not a natural process of going into a schizophrenic pathway, if you will, meaning, you know, I don't know who I am today. Well, listen, there's ways of getting that. In our society, in the Western culture, we experience that more so than most every other cultures around the world. And it's because of the environmental stresses, the physical stresses. There's so many people now that are way too heavy. They got that educated belly around them, and there's this skinny fat person as well. They don't have the muscle mass. Everybody's sitting in front of their computer. They're drinking coffee. They go home at night. They have 2-3 drinks. They're eating candy bars and sodas, and that's their dietary pattern. Sound familiar? I hope it doesn't. But unfortunately, for a lot of people, that's the way they eat all the time. That's their lifestyle. And then they go from the car to the elevator to their office, back into the car, and pull into the garage, and that's the end of it. They get in front of the tube and they eat something, and they're flicking, and maybe they pass on the couch, and they start all over again. And we wonder why we have problems, but particularly when we're dealing with these symptoms of menopause, the hot flashes and all of that craziness that we go through. It's not normal. And that's the thing that I want you to understand. The hot flashes, the change in emotional platforms is not something that we should experience. But we start very young, and we're altering the biochemical makeup of our world by doing what? Well, early on, we're on birth control pills, and we've had all these vaccines. I just read an article yesterday, back, when I was a kid, by the time you were about 12 years old, maybe you had about a dozen vaccines and inoculations, and we're setting aside any kind of antibiotics. Today, as a recent publication, 76 by the time a child is about 7 or 8 years old. And we wonder why we're sick. We wonder why we're seeing the onslaught of chronic immunological diseases and also hormonal dysfunction over a period of time. I want you to remember that's part of it, because we're seeing more and more. The rate of transitional hormonal problems is growing exponentially. That's why I tagged the program today, Dr. Jekyll and Mr. and Mrs. Hyde, Hormones and Your Personality. But we want to get into that just a little bit and understand why we react, because our brain is becoming metaphorically swollen, and we can't process. It's affecting immunological responses. It's affecting the way we respond to things. The liver is going to be one we're going to really focus on. And because why? In Eastern medicine and Chinese medicine and Oriental medicine, every organ in your body has an emotion that it is responsible for modulating, adapting, controlling, and so forth. The liver is if it's working well, you don't react very badly. And I mean, it has to be working, right? But the rage, if you will, the anger that comes up, that's liver function. And it can either be initiated by being angry and irritated at something or somebody or some situation all the time, because we've never learned how to calm that system down and go into a meditative process or pray every day. And so it seems like prayer and meditation have gone out the door for a lot of people. And we need that quiet moment, maybe just to get to know who we are again and get away from all the talking heads and get away from the ongoing insult of our day to day. But we don't do that anymore. We don't spend time with people just to relax, just to have a little fun, just to smile, so that liver becomes toxic. But here's the other place. Now, think about the foods that we eat. I've told you many times, I'm first generation of this country, and the food that I grew up with in my grandmother's house and my mother's cooking and so forth, and in the old country when I go to visit, is not the food that we're given today. The food we have today compared to that is truly poison. It's not good, nourishing, sustainable process. We tell patients you're gluten sensitive. Well, the next question should be, what gluten? Because there's multiple proteins that affect gluten. One that affects the intestinal tract is gliadin IgA antibody, and that's a reactive to one form of protein. But we've manipulated genetically our wheat products so they have far more gluten in them than they are grown naturally. We hit all kinds of preservatives and sprays. Those of you who like to have a glass of wine, if you're drinking it out of California, the major producers, glycophosphates are very high. The sulfite levels that are mandated for stabilization and preservation in this country are very high. I mean, you might be able to get a better one in a small boutique winery, but just think about it. You like a glass of wine? And then guess what? If you're drinking wine all the time and you're having cheese and you're having this and you're having all that, you're going to perpetuate the growth of something called mold and yeast in your body. The side product of that is something called aldehyde. What is aldehyde? Aldehyde is an alcohol. Where does it have to be processed? In the liver. So this poor liver of ours that sits there trying to make us, be able to survive the environmental slings and arrows is getting beat up all the time because of what we are putting into our system, what we're being exposed to, the electromagnetic fields and so forth. So what we want to do is calm that system down from insult, but then clear it, detoxify it. So first thing we have to understand is what it does, right? What really is going on. And by the way, on the 13th of November at the Roselle Center for Healing in Fairfax, Virginia, we're going to be doing a night. I'm going to be co-hosting with Dr. Stephanie Pina, who is a brilliant naturopathic physician and acupuncturist. And we're going to be going back and forth. She focuses in women's health problems. And I'm the guy that's going to show you. See, I like to stir this stuff up because when I do that, you'll say, how could that be true? And then you're going to do your homework. And then you're going to go to things like PubMed, and you're going to read many different articles. You're going to go to Frontier. You're going to go to the Townsend Letter. You're going to go overseas, the British Medical Journal. They know more than we do, by the way. And you're going to see what really can be done. But join us. Come. I promise you, you're going to walk away with a ton of data, and we're going to give you an opportunity to be able to get things taken care of. You don't have any obligation, by the way, just join it. But I'm going to give you answers that you wouldn't normally have. I'm going to teach you what happens when you've been on estrogenic hormones for a long period of time. I said birth control pills in the beginning of the program. Well, guess what? Then we go into hormone replacement therapies, and then we go into xenoestrogenics. What does that mean? That means that there are estrogens all around us that the body can't handle, in plastics and electromagnetic frequencies and things that they put in our animals. When you eat an animal that is not free-range, organic, grass-fed 100%, you're eating whatever they put into that animal, whatever they injected into that animal. That's going into your body. It's the same thing with plants. If they're not organic produce, you're going to get that in your system as well. It's like nursing from your mother. Whatever your mother eats, you're going to get. So the same thing, whatever that animal has had its exposures to, that's going in your body as well. And we wonder why we're seeing so many chronic conditions that are exponentially causing our body to suffer worse transitional processes like menopause and andropause and so forth. So we said the liver's emotional platform is when it's overwrought, when it's toxic, when it can't get rid of itself, is anger. There's an old expression called dry drunk, right? What that simply means is a guy that hasn't had a drink, a woman hasn't had a drink, and she's trying to go cold turkey. Well, you don't want to be around that person because they're going to explode all over you. That's why they used to put them in a padded room until they could dry out, typically dry out, right? Because they go through. Today we know with certain things like glutathione and glutamine and B complex and things like that, we can make that a whole lot easier. But we have to understand the process and why we go into this abnormal schizophrenic pattern, if you will, that is not okay. It's not the way it should be. But so let's talk about detoxification and phase 1 and phase 2 and really what it means and how that all works. Because if we don't understand the process, if we don't understand what it really does, then it's like, oh, this is conspiracy theory garbage, right? No, it's not. It's not conspiracy theory. It's the way the body works. But your physicians know less about this than you do at this moment in time, just listening to the last few minutes of the program. Sometimes go in and say, hey, doc, my estrogens are broken down, I think, right in the liver. And if you get a glassy-eyed look, then jump to the next question. How does that work? What really happens? And if they can't come up with something that tells that they really partially understand the process, then we got a problem. But here's the deal. So you have phase 1 and phase 2, and then we know there's a phase 3. But phase 1, phase 2 are really the important pieces that we that we deal with. Phase one takes the estrogens and the progesterones and the testosterones, and it begins to conjugate them. It begins to break them down. Another expression, if you want to look it up, for phase one detoxification is called cytochrome P450. It's a group of enzymes, basically, that allow the body to work. So what are those? So the reactions that occur, if I told you, you kind of get glassy eyed. I'm going to talk about oxidation, and we're going to talk about redox reactions and hydrolysis and hydration. And if I remember, it's dehydrogenation. And sometimes it skips a little bit. We're getting to that place where it's not as quick as it used to be, but it's still there. And then it has certain needs for certain nutrients. And those are things like the B complex vitamins, particularly B2, B3, which is niacin, peroxidine, B6, and then B12, but the methylated form of B12, and then glutathione and branched chain amino acids and other little pieces of the components. They're called flavonoids. We get a ton of it. There's many, many different types of flavonoids. Now, here's the deal. If you have an over exaggeration of different things that go in that, and you have a depletion of nutrients, your body is going to react. And it's going to react by swelling. It's going to react by vasodilation. That means that your blood system is going to try to increase its blood flow to try to get rid of some of this stuff. But at the same time, you have swelling, and it's called inflammatory reactions. So when that takes place, you're going to have all kinds of symptoms. And I don't feel good one, a lot of pain in your body and so forth. But here's the deal. What should take place and why it takes place the way it's supposed to take place, right? So phase one detoxification, which it supports estrogenic detox, and that goes in phase two and phase three. So how many of you eat, broccoli sprouts and raw carrots and cruciferous vegetables? But they have to be cooked, by the way. Cruciferous vegetables, if you don't cook them, are going to cause a problem with your thyroid. Things like green tea and rosemary and things like turmeric, and there's tons of vitamins and so forth. And if your hand's not going up and say me every day, you may have a little problem with that phase one. And we're not even putting in the vitamins. Well, I'll take tons of stuff. Well, yeah, then you take 40 different pills a day and you're not clearing out anything. Phase two is to understand your genetic makeup and profile. We do that through neuromuscle function testing and so forth. And there's different type of enzymes that are important in that area. You need to have things like eggs, particularly the egg yolk. You say, oh my God, egg yolk is going to give me cholesterol. No, your body needs it, actually. That was a myth. That was a lot of BS. That was part of, everybody trying to put you on statins and things of that nature. You need, and if your hormones are too low, you're going to have problems. So that's a different topic. We could talk about this for hours, actually. But the eggs, and you need a little bone broth, and you need these green leafy things. You need pasture-fed fed beef, and so forth and so on. Now, phase three helps you digest and eliminate. It gets it through the body, and that's the next phase. Your body's got to dump it. After it goes through phase two, it's got to get out of your system, and it can't get out of your system unless phase three, which is just outside the liver, really works the way it's supposed to. So phase one is a detoxification pathway. Phase two, if we want to get technical, I don't know if I want to go there with you, it's called sulfation pathway. Phase one, everybody's heard of DIM, and then phase two is Brocco powder, and then phase three is calcium dechlorate. Dechlorate. I'm sorry. Now, all of those have to work for our bodies to be able to handle hormonal imbalances within the system. And that includes you guys. We're not just talking to women here. We're not talking to women. We're talking to everyone. But if we wanted to figure out what really is going on, we start looking at, how old we are and, what are the symptoms that we're starting to have? Are they consistent, with our lifestyle? Meaning you shouldn't be having any of these symptoms. So we have to figure that out. So let's get into what you really can do about this and what takes place and why the whole process actually works the way it's supposed to. Now, we talked about phase 2, and I get a lot of questions from my female and male patients about all the things that are out there because it's super, super confusing. And I'm not here to confuse you, although I've given a lot of stuff. I got to be really careful as I'm going through the data because what I think is just kind of normal for you, it's not. You know, our bodies detox estrogen all day long, has to. And when it doesn't, when it can't clear it from the liver, it's going to go into storage someplace else. And some of the areas of storage happen to be, particularly if it's the bad estrogenics, go to what? It goes to, guys, for you, prostate, but ladies, for you, the breast tissue, and then other areas. And so now you get an estrogen tag type of potential for cancer. So it's important that we clear that liver out. And, you know, guys that are getting treated, women that are getting treated for cancers, prostate cancer, breast cancer, you know, are overwhelming the liver because they got all these chemotherapeutics that are going in, and it actually makes things a whole lot worse. So our bodies have to detox the estrogen, and we have to do it through phase 1 and phase 2. Then we got to get rid of it. It's got to get out of the body. And that's going into phase 3. But phase 1, estrogen is like a bathtub. It's filling the bathtub up, right? And it matters which pathway the body uses, you know, to get it in there, and also which pathway gets it to get it out of there. Your estrogens are 3 primary different types. One is in estrogenic 2-hydroxy form, a 4-hydroxy form, 16-hydroxy form. And the pathways have to be open to be able to break these things down, and they're individualistic. So there are some reasons that you could consider certain pathway support. But let's talk a little bit about, you know, what shows up if they're not being supported properly. One is inflammation. If you have inflammation in your intestinal tract, if you have poor digestion, that could impact in this phase 3 elimination, detoxification, so it gets reabsorbed back into the body. If you have low fiber diet, meaning not enough vegetables, when we talked about fiber, some of you, you know, if you're going to eat black rices and buckwheat and bulgur and quinoa and so forth, those are good things as well. If you're exposed to environmental chemicals all the time, you live near an area. So let's say you were from Buffalo, New York, and you're as old as I am, or you're in the Pittsburgh, Pennsylvania area, and you're the same, you know, age group as that I'm in, or even younger, because it's in the groundwater there. It's in the ground soil. They had Bethlehem steel both in Buffalo and in Pittsburgh, and they had the coal burning fires. Now, what's the toxic level of coal burning? It's called mercuric oxide. It's one of the worst absorption toxins that you can get in your system, and it causes the liver as well as the brain as well as other things to be problematic. Now, you can have genetic mutations that don't allow you, but that's a very small percentage of people, and you have a deficiency of all kinds of nutrient bases that are there. Phase 2 estrogen detoxification in the liver is critical, and it converts one form of estrogen to the next into a water-soluble form, so your body can get rid of it and dump it and get it out of your system. And those are things that, you know, we need to support with things like B6 and folate and magnesium and choline and methionine and things that support. You've heard the term methyl donors. That's, you know, helping support that methyl pathway. Everybody today says, "Oh, I'm a methylation this. I'm an MTHFR problem." Well, 48% of the population has the original MTHFR methylation glitch, and that means that you can't convert folic acid into folate. And so you have to get that folate in its form of folate. It's already been converted to be able to transport B12, which is necessary to bring down the inflammatory level and so forth. So we have to fix the gut, and sometimes we got to go backwards, right? We got to fix the gut so the gut's not permeable. Then we go to the next phase, and we have to make sure that phase 2 is open, so it's actually being able to convert the residuals of detoxification of phase 1 and be able to put it into water soluble and get rid of it. So we're going to talk about that on the 13th. I'm actually going to take you through. I'm going to make this little confusing, rant that I'm on today much more understandable. You really need to get it. You need to understand what's happening because we're seeing too much. We're seeing too much of this. People are suffering. The reactionary process. We're seeing more and more people today. 1 out of 5 people in the good old United States are on some sort of, if you will, emotional balancing drug. I'll put it that way instead of giving it the actual term. 1 out of 5. That's not normal. It's actually over that. It's over 20% of the population. And that has a lot to do with exposures. It has a lot to do with our body's inability to detoxify. So now we got this crazy Dr. Hyde, Dr. Hyde, Dr. Jekyll, Mr. and Mrs. Hyde platform, if you will, we can't control. We wonder why we can't control it. So there's a lot of things that we use to support our patients. But to begin with, we have to clear everything out. We got to detoxify gently, not going and grabbing all these things. Things like, if you will, dandelion root, organic dandelion root and leaves. Make a tea out of it. Have a cup every night. That'll begin to help you. Black cohosh extracts. Great for certain types of menopausal symptoms, and they work both for guys and for women, but mostly it's a great support for women's menopausal problems. You want to get a clean form of it. You want to use it in a liquid form. We use it all the times with our patients. So black cohosh, by the way, is a flowering perennial plant, if you will. Interesting, huh? It has white blossoms on it, and it has a spike-like structure, and it grows up to 5 feet tall. And it's a member of what's called the buttercup family, and it grows in the woods and both in the eastern United States and Canada and so forth. And it goes by other names too. It's there's one that really got me. It's called rheumatism weed. So rheumatism weed. Remember I said that pain is part of this whole thing? Well, black cohosh seems to bind to your body's opioid receptors. So, hey, listen, if you're in pain all the time and you don't know where it's coming from, and you've had, structural care, chiropractic care, and so forth, it may be a benefit to you. Can't lose. You can get it at most health food stores. You just want to make sure it's a very strong and potent form. There's a doc that I like to read a little bit about. Her name is Dr. Lin. It says both, Chinese medicine and Western herbal medicine have long been involved in the use of black cohosh for all kinds of things, but liver support, and that's why I brought it up today. It's about liver support, and but it also works with musculoskeletal problems, and it helps increase the strength. If you will, in Chinese medicine, it's called tonifying the kidney, and that's where the energy comes from. And it also, ladies, for you, it tonifies the uterus because it balances the hormones out, and it does a great job in doing that. But we've used it for a lot of things. When we treat a patient for arthritis and we're trying to get the nervous system to work properly and turn it back on. So here's the deal. Remember, you've heard me talk about, which comes first, the chicken or the egg. If you treat pain by throwing drugs in it, putting nutritional products in it, neurological support, amino acids, vitamins, neurotransmitters, peptides, all those things, but you forget to turn on the nervous system, it's like taking a Lexus LC500, $125,000 vehicle, putting all the best stuff on it, but you forgot to turn the engine on. If the nervous system's not working without interference, without impairment, if there's structural deviation, if there's partial aberration, none of this is going to work. You have to do both. You have to put them together. You have to make sure that they're working hand and glove together. So don't forget, coming up very shortly, just after the election cycle, right, You're talking about Wednesday evening, the 13th, at the Roselle Center for Healing in Fairfax, 6 p.m. Please be on time, because otherwise everybody gets irritated because I have to wait for you and come in. But listen, no, seriously, join us. How you register is go to rosellecare.com, or you can do it at drtomroselle.com, or call the office, 703-698-7117, and register for the class. And hey, listen, if you can't make it, all we ask is this: pick up the phone, call us, say, hey, something came up, I can't be there. That way we'll have the space for somebody else. Okay? So join us. I promise you, we'll get into this in detail. I promise you're going to have show and tells. You're going to be able to see it. I promise you that you're going to be able to understand it, and you understand how these schizophrenic-like reactions take place. These anxiety patterns, these fear patterns, the depression that you go through, palpation, your heart's flipping out of your chest, if you will. So we have to be able to relax it. We have to be able to upregulate your body's capacity to detox, to be able to calm the inflammatory levels down, to get your mood back to where it's supposed to be, get your body pain gone. There's a way of making that happen. We have to make sure that you understand it and not just take a drug. Not go on here, doc says, take this estrogen, you'll be fine. Then you got to ask the question, is it balanced? Is it blunted? Is it doing what it's supposed to be doing? I don't know if they actually do that with you. But I'll tell you something, if you know what questions to ask, if you know what really takes place, why the pain's there and you're hurting all the time, so you're a grouchy old person, or you're a grouchy young person, you wonder why you shifted. You wonder why that, since you've been on all of these medications over the years, that you're not you anymore and you react. There's a reason for that. And I want you to be able to have the opportunity to change anything that goes on with you. So join me and join Dr. Pina on an evening to remember, if you will, November the 13th, 6 p.m. at the Roselle Center for Healing in Fairfax. Call us. Register online. Simply go to rosellecare.com. That's rosellecare.com. And just scroll down. You'll see the night. Click the box. Register online. And, if anything changes, we'll call you. We'll let you know. And by the way, if you'd like to be apprised of all the things that are going on with information that we provide everybody, go to drtomroselle.com and register there. Put your name in there and good email and so forth. Or go to one of the social media sites, whether it's YouTube or Instagram or Facebook or X or any of those things, and register. You can get it done. We'd love to have you with us and to be able to give you the information ongoing. We have a great store. It's called Ageless Health Store on drtomroselle.com. We've got a whole bunch of things there I think that you're going to be interested in. Things that are going to support your immune system, things that you can learn more about, water filters, things that I use in my own house. There's nothing on there that if it's there, I'll use it. I promise you I will. So check it out, but join us on the night that is a night to be remembered, so coming up on the 13th, 6 p.m., Roselle Center for Healing. And having said that, I'm here every Sunday for you, and only because you deserve the information. If I can help you anyway, reach out, send me a note. I promise I'll get back to you immediately. I love you all. You have a great Sunday.